Republican Representative Larry Bucshon of Indiana. He's important in all of this because he serves on the Committee on Energy and Commerce. It's one of the two committees that drafted this bill. It is nice to have you here. And let me just jump off the bat by getting your reaction to some of your own Republican colleagues in the House Freedom Caucus and senators like Senator Rand Paul, who just this morning, sir, called this Obamacare light. You've got some angry Republicans who say those tax credits just add to entitlement spending. What say you?
Well, over the last year, prior to the election, we worked together in the House Republicans with everyone's input, including people from the Freedom Caucus, to craft the Better Way plan that we all ran on, and we had a positive election result. So there's nothing in here that is surprising. And also, you know, Dr. Price, now the head of HHS, his legislation that he's had for literally years, that all of us co-sponsored, is very similar with tax credits as one of its main components. So, you know, I don't generally comment on what other senators and House members have to say. All I would say is that, you know, this has been an open process amongst Republicans, and so I'm confident that we'll have the votes to pass this, both in the House and in the Senate.
Well, let me ask you about what Congressman Jason Chaffetz said this morning. He said that Americans, rather than getting the new iPhone that they just love, they should go spend $100 maybe in their own health care. Do you think health care coverage for Americans is a choice between iPhones and coverage?
Absolutely not. You know, I was a doctor before, and, you know, those type of comments I think are unwarranted at this time. And so, you know, we want to make sure everyone has access to quality, affordable health care, and we don't want to make people to make choices in their life, you know, having to choose health care and leaving out other parts of their life that everyone else enjoys. So I don't think that's true. I think that this is not going to do that. I think we're going to get costs down. And the other thing we're going to do here is, remember, we're not pulling the rug out from under anyone. People that currently are covered under the Affordable Care Act are not going to lose their coverage, but we're hoping to add more and more people to the rolls. You know, 26 to 28 million people still don't have health insurance in our country, and I don't think that's right. And so we're going to be pushing ahead with this reform bill. Actually, you know, it's a rescue bill. I mean, the Affordable Care Act is going under. The exchanges are failing, and it's just not working for the American people.
And so, Congressman, you say something important. You say there are all these folks without coverage. We want to make sure they get coverage, which echoes what the president said on the campaign trail. But it doesn't echo what some of your Republican colleagues are saying. Jason Chaffetz, again this morning, you know, essentially saying they can't guarantee at this point in time if everyone covered under Obamacare will be covered with this new plan. And then listen to what the director of the Office of Management and Budget, Mick Mulvaney, just said this morning on NBC.
How many fewer or more people will be covered under this new health care plan you've unveiled?
You know, we've started to get that question a lot, and the real answer is compared to what?
Compared to the 20 million that are covered under Obamacare. You just wrote an op-ed on this, sir, and in it you say, we're determined to provide relief to the millions of families facing tough choices here as a result of Obamacare. Can you guarantee that all of those millions of people will get coverage under this plan?
Well, I think, you know, we're taking away the mandates. And so, you know, a lot of people who don't have coverage now, that's by choice. What we want to make sure is that Americans that want health coverage have access to health coverage. And, you know, I don't want to continue mandates on the American people, both employers and individuals. So, you know, it'll be up to the people to make that decision. And the thing we're supposed to do is to offer low cost.
Do you think that fewer people will decide? Do you think that by the time, if this passes, do you think that fewer people will be covered in this country?
I don't know. It'd be by the choice of the American people. They're going to have low-cost coverage options. The other thing is, you know, 20 million people covered under the current law. About half those are Medicaid. We're not taking that away. People are going to continue to be covered.
But you are changing how the Medicaid money is given to the states, and there are 4 important senators from states that have taken that Medicaid funding that are very concerned about how it's done in this bill.
Let me just say this. I'd encourage you to look at what President Clinton and Congressman Waxman said back in the 90s about these per capita caps. They're the ones that came up with the idea, and it's a conservative approach. So this is nothing new. This has been around Washington, D.C. for a long time. States are clamoring for choice. They're clamoring for opportunity to do things like Healthy Indiana Plan, which we did in our state. which gives the state the flexibility to cover its citizens, and we covered about 300,000 people. So I would argue that, this is not a plan that has come out, of the blue. This is something that's been around Washington for a long time, including from what former Congressman Waxman said and President Clinton way back in the 90s. So I would argue states are clamoring for choice, clamoring for flexibility, and we intend to provide that for them. And I think that states are likely to cover probably more people if they choose to do so. And I'd encourage everyone to look at Healthy Indiana Plan and what we've done there.
All right, just clearly to put a button on it, you keep using the words choice, and people will, more people or as many will be covered if they choose to buy it. Do you think any American would actually choose not to buy health care for their family if they truly could afford it and no problem at all, that they're just going to make that choice? For a lot of American families, isn't that an impossible choice to make?
Well, remember, 26 to 28 million people are currently not covered under the Affordable Care Act, and last year, about 19 million people either paid the penalty or got an exemption from Obamacare. So they made that choice.
Because that's the argument that Chaffetz is making. That's the argument that he's making.
So it's not for me to say, what the American people will do. I'm for more individual liberty and freedom and choice in America. And what our opportunity is here to offer people low-cost choices that they can afford, options for their families. And I think that most people will choose a low-cost option for their families.
We don't know. We should know. Just we have to let you go, Congressman. Here is we don't know how much this plan. We don't know how much this plan will cost yet. That is something we are waiting to see the CBO grade. This Larry Bucshon of Indiana. Thank you so much for coming on, and please come back. We do really appreciate the discussion.
Yeah, thank you for having me. Appreciate it.
All right, we're keeping our eye